Greetings to all of you and welcome to a medical outreach webinar event in celebration of the World Health Day 2025. Our theme this year is Health for All. And we are proud to be sponsored by the National Association of CDOCs, Atlanta and Dallas chapters through NAS Atlantis TV. I am Nuka Nkeruwem, your host, and together we will explore how to make healthcare accessible and equitable to all communities, the Health for All initiative. Our team of medical professionals are on hand to help us navigate this topic. They will explore the challenges and advancements in the healthcare system and offer invaluable perspectives to our discussion and answer questions from participants. Without further delay, let's begin by introducing our team members.
Good evening, all. Emeka Eziri. I am a lung and sleep specialist in Charlotte, North Carolina, and good to be here.
My name is Dr. Marcel Akuneme, hospitalist medicine, internal medicine here in North Carolina, Shelby. Thank you for having me.
Chenna Ozua, general internal medicine. I run a private practice in Dallas, Texas. It's very well to me.
I'm Dr. Albert Ubiozo, a pediatrician living in El Dorado, Arkansas. Been in practice for 15 years, and I'm happy to be here.
Thank you, gentlemen, for responding to this important call to action. We have gathered a range of healthcare topics and questions from our audience, and we will rely on your expertise to help us explore these critical topics as they impact on our individual well-being. Our first question is, I have a high BP and on 3 medications, but it does not seem to go down. What do I do?
I'll address that. If you're taking 3 blood pressure medications, it indicates to me that you don't have good pressure control in the first place, which is why you require 3 medications. The question will be what kind of medications you're taking, because for you to properly treat high blood pressure, you have to be sure that you're choosing the right combination of medications and the doses. And secondly, that you are actually taking the medications the right way. And if you are taking the medications the right way, there are other factors, the general factors that you have to take into consideration. Top amongst that list will be your sodium intake. A lot of us take blood pressure medications, but yet we still eat the way we want. So if your sodium load remains very high, it will be very difficult for you to take your blood pressure. In summary, I would say sit down with your doctor and let him, discuss this with you, find out what you're taking and what the combinations are and how you're taking them, and also look at your dietary restriction. It's required that you shouldn't go beyond 1,500 to 2,000 milligrams of sodium per day. Sodium is what you have in salt, sodium chloride. It does cause water retention and increases your blood volume and will work against your blood pressure.
Thank you, Dr. Ozua. All right. Our next question is, why is it a problem if my 46-year-old woman gets pregnant? I don't know if I understand the context of that question. Or is it that the wife is not pregnant? I don't know. Can anyone take that? Or
You're
maybe
concerned about high-risk pregnancy. Also, I can take it, right?
I think that's where he's
Alluding.
pointing out. So, like Albert mentioned, when you're 46, again, it depends on whether it's your first pregnancy or if it's a subsequent pregnancy. But the bottom line remains that you're in the realm of an older head of challenges. Highest, the top of them would be high blood pressure, other problems with the placenta, like placenta previa, which is where the placenta sits further down and can cause a lot of bleeding. So the age and pregnancy, older age and pregnancy, they come with plenty of challenges. If she happens to get pregnant, it's pertinent that she sees her OB/GYN specialist as soon as possible. First, to see how she's doing generally, look into medications that she's taking, and screen her for other possible problems. Outside her blood pressure, there's also diabetes, which can be a problem, gestational diabetes. So it's important to address it as early as possible.
And if I may just say something that applies to pediatrics. The older you are in pregnancy, it increases the risk of you having a baby with what we call congenital anomalies. And the possibility the baby can develop and how you can have a baby with Down syndrome and all that. So that is another pediatric aspect that makes it very important.
Yeah.
I also
So
want to
you,
chime in a
Dr.
little bit
Biozo.
on the
Okay, yes, go ahead, please. Go ahead. The more
yes,
the
but I want to
merrier.
chime in a little bit on the first question, regarding the poorly controlled hypertension. I think the other thing to consider is, why are you actually hypertensive? Is there a secondary cause to it? So it may be something that, whoever this person is should sit down and figure out, why is this happening? Secondly is, if you snore and you're hypertensive, you may want to consider discussing whether you have obstructive sleep apnea, because those things have been shown to make the control of hypertension to be resistant. And that may actually be an easier way, to get off your medications if that is the case. Those are things to consider. Bottom line is that, just like Dr. Oswald said, spend some more time with your primary care physician to really take a much deeper dive into why you are still on 3 medications and not being controlled.
Thank you. Our next question is, I have a niece who is pregnant and she has high blood pressure. She has not had an OB appointment yet. When is the best time / trimester to schedule an appointment?
as soon as possible, whenever you find out you're pregnant, schedule your appointment. And now that she already has complications from the pregnancy, that makes it more urgent. So she needs to see her OBGYN as soon as possible. She's not going to wait for a particular trimester, because the complications from the pregnancy and the high blood pressure are now piling up as she waits. So she needs to see her provider immediately.
All right.
The
Thank
part
you,
of
sir.
pregnancy issue is the issue of fetal death. So you don't want a child with congenital anomalies or lose the baby because the baby died in utero, or baby born with multiple problems and dies within a few hours of birth. So to avoid all that complications that come with the pregnancy, these things need to be controlled. That's the reason why there's effort is made into maternal care and looking out for the mother at this time. Caring for the mother is invariably caring for the baby, and that needs to be done as soon as possible. With her having complications, that is more urgent. She needs to see her provider now.
Thank you.
I just want to add to what he said. With regards to which provider to see, it doesn't have to be her OBGYN. She can see one, that's fine. But
Can you speak
as a
louder?
primary care physician, I was saying, sorry about that. I said that with respect to which provider to see, it must not be her OBGYN at early in pregnancy. If she has a primary care physician, she can also go see a primary care doctor who can manage her high blood pressure up till 18 weeks, sometimes 20 weeks, depending on the environment. But the point remains that she needs care yesterday.
All right. Thank you. The next question is, what is the cause of a neuropathy and how can it be avoided?
Generally speaking, we usually leave that for the neurologist. However, there are many factors that come into play when you're talking neuropathy. So, there's physical one, there's a mechanical impingement on the nerve, or the nerve damage from multiple causes, from poorly controlled diabetes, high blood pressure, many other medical problems. So it's not a one-stop shop. So we need to figure out what's the root cause of that. So if it's something physical, that might require physical exercise, rehabilitation, or surgical intervention. But if something like diabetes, high blood pressure, those ones, and something it didn't develop overnight, this is something that's been pulling up for multiple years because of poor control, and the nerve endings to that region of the body is being destroyed by that poor control. So those are also part of the reasons that cause the neuropathy. So you need to sit down with your primary care physician and figure out what exactly is causing what, and then they will take the next step and decide what further studies or intervention you need to do for therapy, if possible.
Thank you. I'll use this opportunity
Let me add. Can I add to what he said?
Yes, please. You can go ahead.
Can I just
Dr.
add
Kelechi
just a
Arogu,
few other
welcome,
common factors? Like he said, there's always a cost. There's peripheral vascular disease, which is common in people who smoke. There's alcohol abuse. Excessive alcohol use can deplete your folic acid levels, vitamin B absorption that can cause neuropathy. Medications, especially chemotherapeutic agents. People who have had chemotherapy, especially the group of drugs called the platinum, are notorious for causing neuropathy and some other ones. So there's a large group of etiological factors that can cause neuropathy. And like you said, it's defining what the cause is.
All right, thank you. And also the next question is, can we relate long working hours to mental illness?
I think what I hear there is stress-induced conditions that fall out of maybe overworking or
Yes.
burnt out. I think it's a no-brainer. That if you don't pay attention to your whole body and your whole ecosystem, that we tend to get burnt out. And burnt out means that you are literally ignoring some aspects of what should have made up your whole being. So yes, if one doesn't live a balanced life, just focus on working all the time, you can get physically burnt out, you can get mentally burnt out, and you can actually mask other medical conditions that may manifest sometime in life, which could have been easily preventable. So just looking at it from a more global point of view, yes, you could, depend on the circumstance.
All right, thank you. The next question is, can you hear me, please?
Yes.
Good.
Yeah.
Okay. The next question is, what effect has late sleeping and eating has to do with your body when you do it sparingly?
So the body is the system. The body is has its own time frame. We typically, as humans, train to stay awake at time and sleep at night. So if we were trained to do the reverse, we could have done so. But as human beings, that's how we're trained. So we're trained to stay awake at daytime. And daytime, what do you do usually at daytime? You eat, you stay active, you do things that you're supposed to do. And when it's night, you go to bed to rest and recover. If you try to change that whole clock, then you are changing the way your body actually handles some other things, So if you tend to stay awake at night, or eat more at night, then your whole body system will change completely. And that may uncover some other, or put you at risk of developing some other medical conditions, not necessarily uncover. But kind of keeping that habit, quite frankly, will lead you to a much healthier life, because also that's what other people are doing. Now, some animals stay awake at night and sleep during the day. That is how they were trained to do that. But overall, across the board, if you are try to change your body clock, it has some effects that may not be good for you, consequences that may not be good for your body altogether.
Thank you. Next
Let me
question.
add.
Go ahead.
Can I add something real quick there?
Yes, you can.
A common problem that arises from eating late. Those of us who grew up back in Nigeria, there's a habit we had. If you wanted to sleep, in the evening, what did you do? You ate, you had something to eat. So we equated sleeping with eating, because eating makes you sleepy. So we did it during medical school. I did it when I was a student. Study, and when it's time to take a nap, you go and eat, then you go and lie down. So a big consequence of that is that, you develop what you call reflux disease. Reflux simply means that when you eat too close to your bedtime, over time, mechanism that prevents acid from flowing backwards of food from your belly into your throat gets distorted. And so when you eat and you lie down, some of that acid refluxes. That's why it's called gastrointestinal reflux disease. And some people will call it ulcer and all that, but that's one big problem that occurs when you eat very close to your bedtime. It's recommended that even if you eat late in the evening, you should stay up for at least 2 to 3 hours before you lie down. Second thing that happens is that you tend to gain weight. Belly fat and your weight overall increases. And as your weight increases, it puts you at risk of other things, the high blood pressure, the sleep apnea, the diabetes. So it has, what do you call it? One thing snowballs into the other. So it's not a good habit.
Moving right along, our next question is, does drinking cold water have any effect on blood pressure control?
As I learned when I went to Nigeria recently, everybody drinks warm water. And when I said, why are you guys drinking warm water? They said, because we heard that when you drink cold water, it does this and does that. I said, I'm not aware. I drink cold water even in the winter. I drink chill with ice. I guess it comes down to personal preference, but overall, I'm not aware that it has any peculiar or specific problem. I don't know if anybody has
So
any.
can I put it this way? There has not been any scientific evidence to show that drinking cold water causes any known harm to the body as of now. I'll just leave it at that.
All right, good.
Yeah, I think it's more of a myth. So many people back, especially back in Nigeria, have this idea that the cold water causes some problem or the other. They forget that once you drink that water, it goes into your body and assumes the current core body temperature. Like example I gave them, the people in the Norway or Finland have not had more high blood pressure than the rest of the world because their water is never warm. The other thing they talk about is high blood pressure. Or if you drink warm water in the body, it lowers your blood pressure. I had that back in medical school, and I remember telling them that, hey, part of treatment of high blood pressure is to control your water intake. Part of the medication is a diuretic, which actually helps push water out of your system. Fact then was you drink two glasses of warm water in the morning, and it lowers your blood pressure. And there's no fact about that. That's just a myth. It doesn't do that.
So does that have anything to do with the Chinese culture? Because they drink warm tea, there's no refrigerator in a lot of homes there. They believe in drinking warm water. So I thought there was something medicinal about it.
I'm glad I brought up the Chinese. What they actually drink is mostly tea, right? Oh yeah. Now all those stuff that they mix up are diuretics, so they help them to pee
Push the
more,
water out.
and that reduces their blood pressure. That puts them less at risk of developing all these blood pressure related conditions, stroke, hypertension, dementia, those kind of things. So if you wonder why they live longer, it's because of that habit. So as a matter of fact, you should do more of that.
Good.
Learn from that.
That demystifies the whole thing because I've been drinking warm water thinking it makes a difference. Thanks for that. Okay. The next question is, what are the signs and effects of untreated hypertension?
The signs and effects. First sign is death. It could kill you. Hypertension is called a silent killer. It's not going to give you any sign most times. So if you start having signs, you are one of the lucky few. So the signs can depend on what organs it affects. So from just basic headache, you could have a stroke, heart attack, kidney failure. So I don't know how to put it. You just check your blood pressure. You don't wait for the signs. If you wait for the signs, you're already on the late side of it. And that's the dangerous part of it. So the effect depends on what organ is affected. So from nervous system, you have stroke, you have neural damage, so you lose sensations in tissues. Respiratory, because of the high blood pressure, it could cause cardiac failure because it's backing up in your lungs. The kidneys, and same nervous system, you also have blindness. So the signs are multiple and myriad, and it goes through all the systems of the body. And like I said, one of the first signs of hypertension is you're dead. It gives you a stroke or it kills you. So you don't want to wait around till you get signed before you start treating it.
All right, thank you. The next question is, cancer screening test. Any benefits in?
Yeah, of course. Early detection is the key for anything at all. And early detection is the key. So if you can get screened to detect something early, taking care of that is better than, just like Dr. Nema said, waiting for the disease to show up. So also is with cancer. Right here in the US, there are two different guidelines out there. That is one by American Cancer Society, which most people not pay attention to. And they focus mostly on early detection, when to do your mammogram, your colorectal screening, PSA, those kind of things. There is also the United States Task Force. Their own guideline is mostly they're looking at costs. But somehow there are some of their recommendations that appears also to fall into the early detection. When that happens, then you tend to see most clinicians pay attention to it. Bottom line is, mammography would detect breast cancer early, pap smear would detect cervical cancer early, colonoscopies and all that stuff would get you earlier to be screened and to, quite frankly, get to know when to. Now, if you're looking at specific guidelines for breast cancer, the recommendation is once you turn 40, you should start your annual breast cancer screening. And that's the American Cancer Society guideline. The U.S. Task Force recommends instead of doing it annually, you do it every other year. And again, most people will start their mammography at age of 40. When it comes to rectal cancer and all that, the recommendation is, again, at 45, especially if you are of a Black or African American origin or heritage, that would be the time to start. And that could be it could be a stool screening just to see whether you have any blood in your stool, or it could also be a digital rectal exam, which could be done by a physician. And if any of those turns out to be positive, then you need a colonoscopy to see what else is going on. And depending on the findings on the colonoscopy, if they find a polyp that looks like it's abnormal, they biopsy it and keep an eye a little bit sooner on it, as against much later. For cervical cancer, it's once you're sexually active. But the guideline says, 25. The United States Task Force is looking at maybe doing that a little bit earlier. That requires, a pap smear or an HPV test on its own, or the so-called co-test, which is where you bundle both the pap and the HPV at the same time. There is also for prostate cancer. We talked about it. It's one of those that there's really not much of a clear guideline onto it, except that once you hit 45 and you're of that age group, African Americans or have a family history of cancer, then you want to start early at 45 to start getting your PSA. With or without the digital rectal exam. But otherwise, most of prostate cancer screening has to be a discussion that you have to have with your healthcare provider. If you are a smoker, you also need to be screened for lung cancer, especially if you smoke for more than 20 pack years, which is pretty much saying that you smoke a pack a day. And if you do that, whether you smoke or you are still smoking, and you looked at that you smoke for more than 20 years, on average of about a pack a day, I'm sorry, then you need to have a CAT scan, and it's called a low dose CAT scan, which is a much lower dose of radiation, but just to see whether there is a chance of running into a spot in your lung, which would either want to do a biopsy or keep an eye on, or those kind of things, So those are the basic cancer screening out there. But the bottom line is, think early, get on it as early as you can. Most of these are paid for by most insurances, and early detection is a key.
Right. Thank you. That was
I would like to add that or reiterate the fact that if there's any of these things in your family, previous history, the detection now means that your screening is advanced 5 years ahead. So instead of waiting for support you to start your breast examination, you're going to start at 35 if you have a positive family history of that. Same thing with the colonoscopy for colorectal issues.
How can one reduce the impact of memory loss? That's an interesting question, isn't it?
Yeah, it's multiple things that research is not so clear cut on that at the moment, but there are a few things that we know about. One is balanced health style, two is control all that you can control.
So I think what comes to mind first is when it comes to memory issues is dementia. Dementia has it's a broad spectrum, but I think at the end of the day it causes memory. The key thing is memory problems, cognitive
Element.
impairment. Okay, and most of the times it's their short-term memory that's affected. A lot of them have long-term memory issues. That's on one side. On the other side of memory issues is recently we've learned that menopause impacts your memory significantly. Mental illness also impacts your memory. But at the end of the day, the key is memory loss. I am thinking, I don't quite understand what the person wants to know, but what I think that I always advise, the person who has memory loss needs help, especially if it's progressive and advanced, like a lot of care. Sometimes they need one-on-one care because they need somebody around them all the time to supervise them. So that helps them at least because some of them don't recognize who they are, they don't recognize who their family members are, they don't even recognize where they are at any point in time. They don't know the dates, they don't know the days of the week. So that can sometimes cause frustration, which manifests in as behavioral problems. They get aggressive, they get violent sometimes because they are frustrated and because of their situation. So overall, they do need a lot of help. To minimize the impact, I think that's what you need. You need help in the form of caregivers to provide that one-on-one care for them. Sometimes, for those who are not very bad, we help them by putting up pictures, putting up charts, family members, you have a clock, and you write the time, you have pictures of family members to remind them who each person is. You have pictures of various things like, the month, the day, and all that. Essentially, it comes down to providing care, okay? Providing a caregiver for them, whether it's one-on-one or at least somebody around.
Right.
I would like to chip in on what he said, in addition to what he said. I'm not sure whether the question is addressing prevention or the causes itself, but like you mentioned, the causes are myriad from multiple things. Some is familial, some other ones is traumatic from a trauma, some psychiatry, some medical issues also cause that. So if you have like part of the spectrum of the untreated diabetes, high blood pressure, and other medical problems, you probably end up with some form of dementia. One of the ones from diabetes is the hypoglycemia, when you have very low blood sugar. Unlike high blood sugar, where you have the nerves being just altered, in low blood sugar, your brain cell actually is burnt out, it's dead, it's going to be replaced by a scar. So very low blood sugar is part of the problem. So you can imagine what starvation and hunger does to the brain. So it stops your growth, it changes um the tissue itself, the nerve endings. So backing from that too. So basic thing is diet and exercise, and then excess alcohol use also causes that because you're denying your brain some nutrients. So you could end up with like what we call Korsakoff neurosis and Wernicke's encephalopathy. And some of them, if it continues ongoing, becomes more permanent, or you never come back to your baseline of mental function that you had before the event. So continued insult on the brain leaves scars on the brain. We also have the one from high impact like trauma from playing football, American football. So there are so many things that cause that. So everything boils down to lifestyle changes, whatever you're going through, control it, and every lifestyle changes in moderations, excess alcohol, no excess smoking, no use of drugs, and diet and exercise plays a good role in this too. I do remember a research that showed that eating a lot of berries, especially colored fruits, all have brain protective or dementia protective effect qualities. So all those colored fruits, berries, are part of the lifestyle modification that could help reduce or prevent dementia. and then quality of life. So you're sleeping properly and working good set of hours, so no extended set of hours of work for prolonged period, or not messing around with your sleep cycles too frequently. So all those things do everything leaves a mark on the brain, and you don't want that to be a continued insult that will end up with scars that will be your dementia.
All right. That's good information. Okay. So next question is, how can one prevent aging process?
Prevent what?
Aging.
Aging. Some of us
Uh,
want to live, you know.
Yeah, unfortunately, we have not discovered that Peter Pan gene or elixir that works. There's a lot of research going on aging at the moment. They found out that some jellyfish, after like several thousands of years, just degenerate and revert back to um, a new birth. So they're working on that. So at this point in time, we don't have anything to stop aging process. And it'll be interesting to figure out what part of aging the person wants to stop, because I don't think anybody wants to remain at a toddler age. I guess the question is, when we get adults, we don't want to age any further, and that is still in research. But living a healthy lifestyle, moderation in our choices and what we imbibe in goes a long way in preventing a rapid decline in health.
And just to chip in, I think maybe the question should be more of about longevity. And it's been found that, the people in the Japanese are actually the longest living people. And, there's been some not big studies done, and they found out that their diet is what helps, and also the Mediterranean people. So there's what they call the Mediterranean diet. And it's found to help, that is probably what helped them have that longevity. Also, another thing that is the dietary part, and then exercise. All right, and then doing everything in moderation, and then trying to take care of your health, going for your checkups. So that will improve your longevity, and I think that will be what I would recommend.
Family vice.
yeah, that question also ties into it's like how would you slow down cancer prevention, same thing too. Okay. So it's all about moderation in our lifestyle. It also has to do with paying attention to our medical condition and tightening it up as much as possible. For example, it's not unusual for people to say that they have hypertension or high blood pressure, and all of a sudden checking with them, they say, oh, they stopped their medication because the blood pressure had gone. This kind of perception is out there, and you know very well that that's not that's not going to fly. But eating healthy, drinking less alcohol goes a long way. A drink a day for men, 2 drinks per day, 12 ounces of beer, which is probably a bottle of beer, 5 ounces of wine, and any those kind of things. All those things at the end of the day, it's not just reducing your blood pressure, it improves your uh, cognitive ability. It makes you to feel younger. It makes you to feel healthier. It makes you to also live longer. So it all adds up. It's not just one thing.
All right, that's good. Now the next one is, what is the best treatment for persistent arthritis, pains, and aches?
The treatment for arthritis depends on the cause. There are different categories or types of arthritis. The common ones that I would assume that we're talking about is osteoarthritis. Very common with as you age. Simply defined, it's just overuse. Arthritis, when your joints are overused or due to longevity, living long enough, the joints degenerate. So can affect any joint. It can affect your fingers, your wrist, your back, which is a common place, the knees. Those changes, because the bones, the joints degenerate, of course, they cause pain. Common problem that would contribute to that pain is weight gain. The joints are already compromised and we gain a lot of weight, especially like places like the knees, the back. That's why most of our old mothers in those days would tell you they have rheumatism. That's what they used to call it. Affected the knees. So common treatment is Tylenol. We recommend the extra strength Tylenol which is Panadol. I don't know. I remember in Nigeria it used to be 500 milligrams. I think that's the equivalent of the extra strength. Yeah, we have 325. So you should take, usually we'll take two, which is 625. But for the extra strength is the 500. You can take two of those. That's one. Two is your non-steroidal anti-inflammatory drugs. Motrin, ibuprofen, protein, those group of drugs, which again should be taken as needed and sparingly. It's caution, given the other effects that they have. Eventually, there's also physical therapy, which can help depending on the area of the body that is affected. Physical therapy helps, like, with mobility and all that. But finally, last, like they say, all else fails, surgical treatment. There have been advances in the way these things are treated these days. I've seen 85-year-old women, elderly patients, we treat them and they go home the next day, even sometimes the same day. That's for osteoarthritis. There are other forms of arthritis, the rheumatological diseases like rheumatoid arthritis and a whole bunch of rheumatological problems. If you have any of that, then you have to address the primary problem, in which case you need to be seeing a specialist, a rheumatologist, to define which kind you have and also provide appropriate treatment. Bottom line, after all else fails, after you've been treated medically and it fails and the joints are seriously destroyed, might require a joint replacement, which is surgery. So in simple terms, that's sure.
Right.
Can I add?
Yeah, go ahead. Go ahead, please.
Just to add more on the effect of exercises on osteoarthritis. So as far as physical therapy aspect, it's very much established that exercises, especially moderate exercises, replenishes the lubrication of the cartilages, which are affected by this osteoarthritis. Also, to strengthen the muscles around the joints. For instance, osteoarthritis commonly affects the knees, so you want to strengthen the muscles around the knees, like the quads and the hamstrings. It really helps. Then again, weight loss is key. So, because the increased weight increases the harmful effects of arthritis. So when they lose that weight, they kind of regain some function and have reduced pain. That's the reason why before they even go on to have like a joint replacement, doctor recommends that they be at a recommended body mass index before they go on with the surgery. So I just wanted to add that today.
All right, that's good. Next question is, what are your views on the recently approved weight loss solutions that are out there, like in the likes of Wegovy and other treatment options?
I actually use those medications, so I can chip in here. Those medications are very, very useful. Remember, they were Wegovy is semaglutide, and Mounjaro is tirzepatide. They're called GLP-1. So semaglutide, tirzepatide, GLP-1 and 2 agonists. Essentially, what they do is they affect the way you eat. They make you feel less hungry, make you less interested in eating. And the long-term effect is that you eat less, and if you eat less, you lose weight. Weight loss is advantageous for people who have diabetes, which are the group of people that the medications were diagnosed with, developed for initially. When you lose weight, you control your diet, you achieve it. But as a secondary effect, they found that it makes you lose weight. So most people also have been using it to lose weight. And like in America, you cannot use the same medication, the same brand name to treat two different medical problems. So you have to rebrand them. That's why semaglutide has Ozempic for diabetes, Rybelsus for diabetes, for weight loss. Tirzepatide has Mounjaro for diabetes and Zepbound for weight loss. So they're all the same drug on each side, but used for different things. To cut it, in a nutshell, they are useful. Dr. Zuri can tell you, Zepbound is being promoted for people who have sleep apnea. They believe that if you lose weight, a lot of problems, symptoms will diminish because all the side effects go with it. On the other hand, for every other person who lose weight, again, the common things like the reflux disease that we mentioned. Even women who are branded to have polycystic ovarian syndrome, who don't have children because of the irregularities with their menstrual cycle, insulin resistance. We treat them with these medicines, they lose weight, they begin to see their periods, and the next thing they're pregnant. It's been recorded. Ozempic on its it has been known to show a significant decrease in cardiovascular disease. So the two big advantages are, one, cardiac disease, cardiovascular disease, two, on the other hand, for congestive sleep apnea. But overall, drop in weight with the attendant advantages. We just mentioned osteoarthritis, and we just mentioned losing weight. So, are these medications useful? I do agree that they're very useful. Do they come with issues? Yes. In people, majority of people do tolerate them very well. Some people just not. Everything is not meant for everybody. But this is the modern way to deal with diabetes. The best way that we knew in the past was insulin, metformin, and all the other drugs. Insulin is very good, but it's not good for your weight. It makes you gain weight. It makes you gain weight. So these medications actually help you lose weight and also control your diabetes. So it's a new way to treat. But like I said, they make you lose weight, so highly beneficial.
All right. Thank you. All right. The next question is, I am pregnant with my second baby. This is an unplanned pregnancy, and I just found out last month my OB appointment is in May. I am on metformin and sitagliptin. Are they safe for my baby?
I don't think they are safe for the patient. I think she should, if she is unable to see her OBGYN immediately, she should go see her primary care physician so that he can rotate her to other medications.
Okay. The next question is, what are the causes of epilepsy?
So
Can you hear me?
let me come in. Yes, let me come in. So epilepsy is a situation where there's I'll call it an electrical malformation or physical malformation in the brain, where the activity, because the brain, you have the neurons that help to control how your brain functions, and sometimes they misfire. So when they misfire like that, then you can start having the symptoms of what we call epilepsy, where because the brain is what is like what controls the rest of the body, tells you when you want to move your hand and how to do things. So when they misfire like that, then you start having what you call seizures. All right. So people with epilepsy will have recurrent seizures. So sometimes, and there are certain triggers. Sometimes it could be stress or anxiety. There are so many triggers or illness. And these patients, the brain misfires and then they start having, seizure-like activity or seizures. All right. Now, the epilepsy itself is a lifelong condition, which can be managed with medication or other factors. So if a patient has epilepsy, the patient will need to be seen by a neurologist. And when the patient sees a neurologist, they're going to do some tests, the first one is probably they'll do what we call an EEG to check the brain activity to see if there's misfiring in certain areas of the brain. And usually if a patient with true epilepsy, there's going to be some area that is misfiring. After that, they might do an MRI just to see if there is a malformation, a defect in the brain that's causing this. And then based on this, epilepsy can be classified into different types, depending on how the person presents. Some of them will present with falling out and having general shaking of the body, which is called generalized epilepsy. And some will have what we call partial epilepsy, where they might have symptoms, might not just have that generalized shaking of the body. It might be focal, where the one part of their body is moving or they exhibiting some kind of behavior, which you might not know, but they are epilepsy. Based on the classification, so we have the broad generalized epilepsy and the partial or focal seizure. So now, based on this, will determine there are so many medications that can be used to treat epilepsy. But you have to see your neurologist, and they're going to put you on the medication for the type of epilepsy you have. A lot of times, these medications are able to control the patient's seizures, and also there has to be lifestyle modifications. And there are certain things patients with true epilepsy cannot do, so because they can endanger themselves. Some of them are not allowed to drive because they could have a seizure while they're driving. That you can imagine that. So they'll put them on medication depending on the type of epilepsy, and hopefully their epilepsy is controlled by this medication. Some of them have to wear a neck bracelet that tells people that they have epilepsy. Now, in the case where these patients cannot be controlled by medication, you can do multiple medications. If this doesn't work, there are some surgeries that can also be done for these patients. So it's always important to diagnose epilepsy early, especially in children, because sometimes children might not present the way an adult will present with epilepsy by shaking. A kid might just be, my mom might come in and say, my kid is always blinking. Every time my kid is blinking, I'm not doing anything. That kid is probably might be having a seizure. The only thing the kid is doing is just blinking. Every time I'm looking at her, she's just blinking and not responding. And that is very dangerous, because if that kid is not treated early and diagnosed early, that kid will end up with permanent brain injury. So it's always good, especially in childhood, to diagnose epilepsy early to prevent long-term brain damage, which can affect the child for life. And of course, after it's been diagnosed, well, most of the time they're going to present to the ER or to their primary care physician. And from there, the next thing that they are referred to a neurologist, where they get the necessary imaging and the seizure characterized, and they started on the appropriate treatment. But very important that it's diagnosed and we know the signs of seizure, especially in children.
Thank you for that. And I think we are inching towards the 1 hour mark that we planned. I guess we can take one more question.
I would
Can you
like
hear
to
me?
chip in on the epilepsy.
Yes. Okay. Let's
Throw it again.
and then we have a myriad of other questions that would need to be addressed. That's going to be for the next session. So please, the floor is open. You guys can chip into that, please.
Yeah, I want to chip in that before you're allowed to, when you diagnose with epilepsy, you develop what's called a body system. So whatever you're doing, try and have somebody with you. Then you never ever dare go into the water without somebody being with you. And in terms of driving, you're not allowed to drive until you're 2 years free of seizure on your medication or off your medication. That's the only way you get back your driving license, just for the records. Because you have people who have it and they'll try to hide it because they know they will lose their driving license and their freedom. So you just have to press it on them that um, you run the risk of killing somebody or killing yourself. Yourself, okay, but killing somebody, I don't think you want to live with that, knowing that it was something that was totally avoidable and you took it upon yourself to engage in dangerous activities like that. So you have to be at least 2 years free of a seizure before you are allowed to drive.
All right. Excellent. I think we are at that 1 hour mark, and I'll use this opportunity to thank you guys, extend my heartfelt gratitude, esteemed guests and speakers, for sharing your valuable insights and expertise with us today. Your contributions have been truly enlightening and essential to our mission of promoting health and wellness. To our audience, thank you for your active participation and interesting questions. With this, at this point, I'd like to officially conclude this virtual medical outreach in celebration of the World Health Day 2025. And let's continue to work together towards a healthier world for everyone. And thanks, everyone. Peace.
Thank you.